Hey, Eastern Oregon, thank you for joining us tonight on this special multi-agency conversation about COVID-19. This is hosted by Grand Ronde Hospital. And of course, we're going to start right off with Jeremy Davis, President and CEO of Grand Ronde Hospital. And thanks for arranging this, putting this all together tonight. Let's just start, kind of tell us why we're here, Jeremy. Why are we together tonight?
Sure. Thanks, Brent. Yeah, really appreciate you taking time. You know, our sole focus today is really to talk about hospital capacity and concerns that we are starting to see both locally and regionally that could impact the provision of care here in Eastern Oregon. All
right. Well, so and boil that down a little bit more. How are you hoping the audience is going to respond locally to help you, Grand Ronde Hospital, help themselves in this situation?
Sure. You know, the reality is that a lot of the things that we did early on in the pandemic were really meant to be around protecting hospital capacity. You know, and I would be remiss if I didn't take a chance or an opportunity to thank, you know, during these unprecedented times, the outpouring of support that we've had for our healthcare workers. You know, I also want to thank those that have joined us on this multi-agency call for their support of healthcare workers. And we also know there's a lot of folks who aren't on this call with us, but have shown a lot of support for the hospital. You know, really my concern and the reason for this call is the current state of hospital capacity. I want to make it clear that GRH is doing okay, but I say that very cautiously. We are not immune to the effects of COVID-19, and especially the Delta variant that is proliferating here in Eastern Oregon, especially in Union County. You know, our providers, our nurses, our staff are tirelessly working to take care of this community, and in spite of an unrelenting pandemic that is stealing lives, that is dividing a community and a country, and is impacting our normal way of life. And so our staff are tired, our staff are exhausted from the demands of COVID. You have likely seen in the news that the Oregon National Guard has been deployed to several hospitals in Oregon and to help hospitals with the COVID-19 surge. Alarmingly, younger folks are starting to be hospitalized. In fact, at one point last week, all of our COVID positive patients in the hospital were between the ages of 40 and 70. So this is certainly affecting a much younger population than we had previously experienced. As I mentioned early on from the beginning, a lot of the decisions that were being made from a policy standpoint and otherwise was really done in the spirit of trying to protect hospital capacity. Early on, there was an immense concern around ICU beds, ventilators, and the availability of critical care services. And for the most part, Eastern Oregon has been spared. Certainly, we've had some blips, but that's the beauty of the hospital is we're used to dealing with some fluctuations in patients. But this is a little bit different. And that's why we wanted to have this kind of frank conversation with the community. Over the past 2 weeks, I, along with other healthcare leaders locally as well as regionally, have started to begun and witness a real strain on hospital capacity. At one point last week, there were only 2 ICU beds available in Eastern Oregon. And in fact, I believe as of today, there are 0 ICU beds available in Eastern Oregon. The other challenge that we're facing is, you know, like many rural hospitals in Eastern Oregon, including Grand Ronde Hospital, we rely on tertiary care centers, larger hospitals in the Boise area, Tri-Cities, Walla Walla, you name it, as transfer centers, places where our acutely ill patients that we are unable to keep, that we ship to. Many of those hospitals are unable to accept our transfers because they too are at capacity in terms of their beds. And this is not just with COVID patients. These are also very acutely ill patients. We, in fact, actually prior to this little surge here in Union County and across the region, we were already starting to see an increase in hospitalized patients, mainly for folks who had delayed preventative healthcare services over the last 18 months. And the number of ER visits and urgent care visits across Eastern Oregon, and this is Morrow, Umatilla, Wallowa, Union, Baker, and Malheur, we've seen an approximate 200% increase in ER visits. So we are seeing a lot more patients who are not feeling well and seeking emergency services. You know, it is true that we have delivered more babies in the last 18 months than we have had COVID positive patients in our hospital. But that is just it. You know, accidents happen, births happen, injuries happen, and we want to be here for the emergent needs of this community. And given that we are seeing the spread of COVID and the rapid pace of COVID positive cases, we are concerned that this can impact the healthcare system that is already impacting several parts of Eastern Oregon, or Oregon as well. And we want to avoid that with your help. My point is pretty simple. We are starting to see some, what I'm going to call canary in the coal mine situations and circumstances that without the community support could impact our ability to meet the healthcare needs of the community. So our ask is pretty simple, and I've got 3 points that I want to call out. 1, if you are not vaccinated or on the fence, please speak with a trusted healthcare professional and have that honest discussion before saying no to the vaccine. In Oregon, according to the Oregon Health Sciences University, released a study last week that unvaccinated individuals in the state of Oregon are 6 times more likely to be hospitalized and contract, or 6 times more likely to contract COVID-19 than those that are vaccinated. And so the vaccines are working and are helping and are one of our only defenses to protect hospital capacity at this point. My second ask is to wear a mask. We understand that it's uncomfortable. We understand that it's frustrating. You may even think that a mask is insignificant in stopping the spread. However, on behalf of 700 Grand Ronde Hospital employees, our medical staff, and our board of trustees, we must do everything that we can to protect hospital capacity. And then lastly, if you are experiencing any symptoms, please avoid gathering with others. We must slow the spread. So I want to be clear, and I don't want my message to be misconstrued. We are doing okay here, but I also wanted to have a frank discussion that, again, I don't want to be in a situation where we're in an immense crisis and we are not able to meet your immediate healthcare needs. And so this means that our amazing staff are managing through this difficult time and are here to take care of you. But we must band together against this unrelenting pandemic and the variants that we're facing if we want to reclaim the way of life that we enjoy in Eastern Oregon. Please keep your health appointments. You will not be doing us doing this community any service by delaying your healthcare needs. We want to keep you healthy and out of our ER to preserve bed capacity here in Union County and across this region. So really, with that, I think it would be a great time for Carrie to kind of talk about some of the things that she's seeing in on the public health side at CHD in terms of cases and contact tracing.
So, and before I'm going to pull her in here. Thank you, Jeremy, for kind of briefing us. And I do want to give folks a few ground rules that in the hurry of getting started, I didn't give folks. And that is, this is going on multiple platforms tonight. You certainly have the ability to comment on those Facebook pages, but if you have a legitimate concern or question that you're wanting to get to the panel of people that are with us tonight, the community relations at grh.org is the way to do that. And so I want to encourage you to do that. The other thing is I want to remind folks that there's a lot of stuff going around. I mean, there's a lot, along with COVID and the Delta variants, there's just a lot of opinions. There's a lot of this whole issue has been politicized, and I had mentioned this on a broadcast last week. Is that I don't want us to be nasty to one another, and there's no reason for it. Tonight we're not going to get into the nuts and bolts of the scientific legitimacy of whatever course of action that we might want to talk about, or whatever might be discussed out there. There's some great experts here that could answer some questions, but we don't really have time to get into the weeds. Overall, the reason Grand Ronde Hospital is doing this is because they want to preserve the local capacity for your heart attack, your baby being born, whatever the case might be. And the way that you can do that is to do what you know you can do, regardless of whether you agree with it or not. So, did I kind of state that plainly enough, Jeremy, you think?
Yeah, no, that was great.
Okay.
Again, we don't want to be I don't want to be an alarmist, but I also want to be a realist, that we are starting to see data and volumes and circumstances and situations that at our current trajectory could lead to some constraints in the coming weeks.
Okay. And before we go to Carrie, I just want everybody turn your cameras on, and let's have this big Brady Bunch thing. And I'm adding people in no particular order to kind of give everyone an idea of who is in the background. And I don't think I can add everybody at once. But let's see. So let me pull Jeremy out for a minute, and Stacy is here. And so I'm going to pull Robert Strope. Thank you, Robert, for being here out for a second. And George Mendoza is here. So thank you guys for all joining with us and being here tonight. And so give me just a second and I'll pull everybody out and we'll continue this conversation here. This is a little bit, normally I was going to have someone help navigate all this, but we ran out of navigation room. So Carrie, how are you? And your mic is muted. Be sure and turn it on. How are you doing?
Well, all things considered, I'm good. Of course, over here at CHD, we're pretty busy right now. We're definitely seeing probably the most significant surge we've seen throughout this whole pandemic, and I'll get into the numbers, but I really just want to thank Jeremy for the opportunity to be a part of this town hall. I really agree with you that it is time for us to band together and do what we can do. I think it'll make a huge difference. So what I want to share today is just really the basic facts. There's a great panel here, and I don't want to take too much time away from their ability to talk. If you're following the numbers, you'll see the last few days we've had 40 and 38 cases, and pretty consistently over the last 3 weeks, we've seen double digits. I can see 1 or 2 days on my spreadsheet here where we weren't double digits, but for the most part, it's double digits, many times over 20 and 40. And one of the things that's really helped me have perspective on what's going on is to look at the cases by month. Back in June of 2020, we had a week where we had a very, very large number of cases. And at that point, we had June of 2020, we had 336 cases. That's the highest we ever had until today. I know that the numbers we reported out this morning do not tip us to break that record, but we will definitely break that record after we report out our cases tomorrow, I believe by double digits. So I share that because I think, I've shared data graphics where when you look at that June blip, it looks very, very high. But when you look at what's happened over this month, we're seeing more cases this month than we've ever seen before. The last time we were this high, we had 301 in November. I don't have updated test positivity data for the current week, but it was definitely shooting up as well. So we're seeing more people that are being tested are coming out positive. And I think that, we're hearing that people are definitely experiencing more severe illness, which makes sense that they would go seek a test if they were really not feeling well. I think the other piece of data that I wanted to share with the community today is that this week we actually reached 50% of 18 and plus of our population are vaccinated now, and that means that they've completed the series or have at least one dose, I believe. 50.3% today. It's really great to see that number continue to increase. Right now we have, what I like to think about is that, now's the time to preserve our hospital capacity, which is really what we're talking about, to help Grand Run Hospital, to help our healthcare providers. We really need to look at the things we can prevent because, as Jeremy said, the baby's going to come. It is not going to stop because the hospital's full. If somebody has a heart attack or a car accident or a broken arm or a burst appendix, there are so many things that we can't stop from happening and we can't immediately prevent. But COVID-19 is something we can work on preventing literally today, right now, because we can take actions that will slow and limit the spread of this virus. And we have pharmaceutical interventions which are vaccines, which I really appreciate Jeremy's recommendation to talk to a healthcare provider that you trust. If you have any questions or need more information about that, they can help you answer questions and make that decision. And then we have our non-pharmaceutical interventions, which are, staying home if you're sick, washing your hands, wearing your face covering, staying 6 feet apart from people. And, I know that Jeremy really emphasized staying home if you're ill, but we're still learning about the virus and particularly the variants. And, there's a chance that even vaccinated people like myself could get the virus, but the vaccine protects us from those symptoms. And so we still need to be cautious as well in protecting our community. And that's really, I see this as us looking out for each other, which I know Eastern Oregons are really great about doing. And so again, thank you for the opportunity. If there are more specific pieces of data or information related to public health that I can provide later on, I'm very happy to do that.
Excellent. All right. Well, thank you. Well, let's pull in our docs that are a part of this conversation, and have each of you. Now, each of you have a different area, and appreciate you being here with us. And I know, many of you have been kind of on the front lines of what's going on, and so sometimes we haven't had a chance to hear from the docs as much, just because you're doing your thing, you're working, and this is a great opportunity for us to talk. Dr. Steve, I want to start with you, and that is, so if Delta variants is breaking through to some of the vaccinations, some people might ask, well, what's the point? It's breaking through anyhow. And so why don't you start with that and then kind of roll into what you have been experiencing, because you are very much on the front line of things. You are the hospitalist here locally. You're dealing with people that are critically ill and dying from COVID. And so why don't you start? Take it away. Talk to us about this.
Sorry, I had to unmute there. I totally forgot. Thanks for having me. I guess I would say that this immunity myth is one of the most frequently heard myths out there. And I think it's probably gained traction because it wasn't always a myth. Our understanding of COVID is so much more complex now than it was a year ago. And it'll be 10 times as complex next year. But what we understand now is clearly this virus is mutating. And so we're developing different variants. And the initial variant was the alpha variant of COVID. And much like a head cold, mutates very frequently. Coronavirus, this SARS-CoV-2 virus, also mutates very frequently. Some mutations will make a virus more infectious, more lethal. Others will make a virus less infectious and less lethal. We're currently experiencing in this area, according to the infectious disease guy that I spoke to at OHSU a few days ago, almost everything that we're getting out here is the Delta variant, which is different than the Alpha variant. So those of you who got ill with COVID early on, you got ill with the Alpha variant, and you are immune to catching the Alpha variant again. You have natural immunity. Well, guess what? This ain't the Alpha variant that's coming around. And so I'm seeing people who've been sick 2, sometimes 3 times and dying on the 3rd or 4th time around. They got the Alpha, they got the Beta, now they got the Delta. So what we are finding is that so far, the vaccines, especially the Pfizer and the Moderna, which are the 2 most heavily used one in this area, are conferring at least some amount of immunity to both the Alpha and the Delta. And whether it'll continue to confer immunity to different variants, well, I don't think anybody can know because we don't know about them yet, so we can't study them. But so far, the vaccine-given immunity seems more effective and more long-lasting than your natural immunity.
Good. All right. Let's talk to Dr. McLemoyle for a minute, and Jeremy, you can chime in here. So, what are regional hospitals experiencing? Let's pivot back to the capacity issues. And Dr. Mack, you're in, I know that's what we call your brother. Is it okay we call you that too? Anyhow, so you're in ER. You are on the front lines of transferring patients when they are beyond the care of Grand Ronde Hospital. I don't know, maybe the two of you talk about the capacity issues that you're seeing of the overall system, which is the reason we're having this whole discussion today.
Yeah, we've had quite a few patients in our hospital recently, and we've had to transfer not just COVID patients, but other sick patients, whether it's due to, a problem with diabetes or something like that, dialysis or anything. And we've had to make several calls throughout Idaho or Washington or the Portland area to try to find somebody to be able to take them. We've been seeing a lot of patients in the ER, which is slowing us down. We're trying to get to everybody as quickly as we can, but it's difficult right now because it's hard to transfer patients. It's hard to get them admitted to our hospital because we are low on beds at times.
So, Jeremy, do you want to jump in there?
Yeah. So, again, I think Dr. McLemore hit it on the head is, given the increase in volume in the ER, we're also seeing folks that are very sick and are sometimes beyond our capacity to take care of them. And so we're going beyond our close region in terms of trying to find an available bed. I actually spoke with another hospital in Eastern Oregon, and they had to ship a patient all the way to Montana. One of our ER docs, I think last week, it took 41 phone calls before they found a hospital willing to accept the patient. That takes time, that takes resources. And so again, as I mentioned, we're starting to see some of those canary in the coal mine situations that are starting to show us that the hospital capacity is being strained across the healthcare system, not just in Grand Ronde Hospital. And so we want to try to avoid that here in Eastern Oregon so we can continue to keep doing what we're doing here and take care of our patients and keeping them local as best as we can.
So, and you and I were talking earlier today, some of that is not necessarily capacity related as much as it is also staff related. I mean, talk a little bit about that, Jeremy.
Yeah, we are seeing a national shortage of staff. This is all the way from providers to nurses to respiratory therapists, even sometimes down to struggling with housekeeping. And again, this is not just a Grand Ronde Hospital issue. One of the largest reasons why the National Guard has been called to several hospitals in Oregon is to provide the support services and the support functions, cleaning hospitals, registering, doing testing. And so the entire health system is really kind of getting punched in the face right now. And again, we're doing okay here. But again, we want to avoid that crisis situation. We want to continue to do elective surgeries here and elective procedures. We want to continue to be here just as you would expect us to be here. Although there might be a little longer wait time right now, but we still are able to provide that service. And that's where the community support is going to be critical if we're going to get through this.
So, Dr. Frank, let's talk to you for a second. One of your roles is to help people, and you and I have had an opportunity to talk before, cradle to the grave. That's your thing, that's your dig. You've done medicine like that your whole life. But we're seeing where people have delayed some of that routine stuff that they need to have done. I don't know, talk a little bit about kind of what you're experiencing and then how that puts a load on everything else that's going on.
Sure. Very happy to be here, and thank you for this opportunity. So my perspective as an outpatient physician is somewhat different than the rest of the panel, and there are 11 providers here at the Regional Medical Clinic, nurse practitioners and physicians, and we see it as our job to not get our patients into the hospital. Our job is primary care, is prevention. Through 2020, there was a lot of reluctance for patients to come into the clinic. There was a lot of fear, and there was a lot of delayed care. And that has had consequences far beyond what I ever expected. And what I mean by that is not only are people delaying routine care, managing blood pressure, and managing their diabetes, which, when poorly managed, lands them in the emergency room. But now that people are finally showing up and getting the care they need, it's allowing us to finally have a discussion about COVID, and patients that have been reluctant to get the vaccination. It's a wonderful opportunity to have that one-on-one discussion and answer questions. But that also has consequences. This all takes time, and it puts us behind, and it's frustrating for everyone involved, including the patients. But day by day, we see more people. We are able to take care of chronic medical problems when we do it in a timely manner. We spare ER visits and hospitalizations, and it's heading in the right direction.
So while I have you, somebody has asked the question: Is GRH providing antibody infusions? What is that, and what is the criteria for receiving that?
That's a great question. So from my perspective, there is a monoclonal antibody treatment for mild to moderate COVID symptoms. Currently, it's for positive COVID patients. There is discussion about use for treatment for symptomatic patients that have been exposed as well. So there's two ways to administer this Regeneron therapy. One is by an infusion up at the infusion center, and also we have administered it here in the clinic as a subcutaneous injection. It has been remarkably effective and well tolerated. It's not without some risk, like everything can be, but it's wonderful to have another tool in our toolkit to offer patients in an outpatient setting care to get so they don't end up in the hospital.
All right, great. So Dr. Whitaker, let's talk to you about babies and mothers, and talk to us about, there's been, we've heard the discussion, is the vaccination safe for pregnant moms? Talk a little bit about that, and I don't know, kind of what you're experiencing in the role that you are in.
So yeah, absolutely. I get that question almost at least once a day, twice a day, sometimes, or more. And at the beginning of the process, I think there was a lot of concern about the vaccination itself, how safe is it, and there was even some hesitancy by the American College of Obstetrics and Gynecology to really completely support it. That has absolutely changed. The American College of Obstetrics and Gynecology and the Society of Maternal Fetal Medicine Specialists are now both stating that any pregnant women, lactating women, any women of childbearing age should definitely get vaccinated. What they're seeing is that people that are pregnant can get more ill from the COVID, and just like Dr. Hunsaker said, even if you had COVID, you still could get another variant. And so we are definitely recommending it. We understand the hesitancy of getting something new when you're pregnant. So far, there have been studies on animals, which is how these always start. There's been over a year now of data on women that were pregnant that had babies, and so far we have not seen a complication from that. And so we are definitely supportive of that. We're supportive of our patients regardless of what they choose, but we are definitely supportive of the vaccine here. And the numbers and the studies are going that it's better to do that than to get the vaccine than to get the COVID. As far as the one question I get frequently is about infertility. If you have COVID vaccine, are you going to be infertile? The truth is there is no good science behind that at all. There's not even a normal physiologic reason that would be true. And so ACOG has definitely stated, and I totally support their statement on this, that is definitely not a reason to not get vaccinated is because you want to have a baby. And in actuality, the healthier you are when you get pregnant, the better pregnancy you'll have. So not having COVID is going to be better for you in the long run, because we do know that COVID can have long-term effects that we're just even still learning about.
Good. So while I have you, there's a question that came in is, why are laboring mothers required to be COVID tested when asymptomatic? And then why don't the partners in the room have to be tested?
Well, partly that's just the recommendation, but there is some good reasons for it. So one is that we have very limited staffing there. And so it is in our best interest to protect our nursing staff as much as possible. And one of the ways that we could do that is by seeing if our patients are positive, because not everybody who's positive will have all the symptoms. And so if they are positive, then we can do different types of protection to try to prevent our staff from getting sick, because sometimes we only have one labor nurse available. And if I have 2 or 3 laboring patients, which COVID has definitely brought out more babies, it is a real problem for safety of that delivery. As far as the partner not getting tested, the truth is that would be great if it was realistic, but it isn't needed as much because we do require that they wear a mask the whole time. And we are not as close to the partner in general as we are to the patient. Let's be honest, when you're pushing out a baby, it can be a lot of things happening that we can get a little bit more bodily fluids and things like that closer to us. And so it's to protect the staff. It is not because we want to torture our patients. It is really just to protect our staff so that we can keep offering care to everybody else after them.
Great, thank you. So Dr. Zach, it's your turn. Let's talk to you about children and kind of what you're experiencing, what your advice is, what the current climate that you're experiencing.
Thank you so much. So first of all, I have my white coat on. This is the first time I put this on for any of these town halls, but I did it very intentionally. This is the first point in the pandemic that I'm legitimately afraid for my patients. COVID was something that when we had the Alpha variant, yes, it was a minor cold. Yes, you could avoid it if you took basic preventative measures. Right now with the Delta variant, the game has completely changed. This is something that is out there and it's spreading. As I've been telling my patients throughout the clinic these past couple of weeks, pretty much it boils down to a choice. Would you like to get COVID or would you like to get vaccinated against COVID? At this point, my patients fall pretty much into one of 2 camps. So I want to emphasize that this is serious, and the best way we have to stop this is with vaccination. But with all safety measures, we also layer them on. So I like to draw an analogy from a car. Just like you have your seatbelt, you have your airbag, your car has a crumple zone, you layer all these things on to create protection. So that's why we also recommend masking. The American Academy of Pediatrics recommends masking in schools as well as masking in public indoor places. This is to help prevent the spread. And this is because it takes time to get fully vaccinated from COVID. So even if you get the Johnson & Johnson vaccine, which is a one shot and done, it still takes your body about 2 weeks to learn from that vaccine and make the antibodies. If you're doing Pfizer, you have dose 1, 3 weeks later, dose number 2, and then 5 weeks from the initial dose, you're now fully vaccinated. With Moderna, it's a similar course, except it's 6 weeks instead of 5 weeks. So the moral of the story is get vaccinated, get vaccinated, get vaccinated. What I would also like to share is with the capacity issue, we do see this affecting patients. I've been limited in my options where I can transfer patients over these past couple of weeks. It does not feel good or comforting to know that there might not be help on the other end of the line. That is a very precarious position to be in, as so many have said, not just for COVID, but also for all of the routine things that happen in healthcare.
Okay, thank you. Let me follow up with a question, Zach, that I know floats out there, and that is that certainly COVID in the past children have tolerated it much easier than what adults have. And clearly that's the whole point. That's why the vaccination was pushed to the adult population before children, and so on and so forth. So talk to us about, the studies I see, there is an increase in children, pediatric COVID. Why does that matter to us? Why connect the dots on the vaccination point? Connect that for us, if you would.
Absolutely. So when we're thinking of people who get COVID who are 0 to 18, you're right that most cases are indeed mild. And I think where the confusion comes down is a matter of percentages. So you'll often see cited, 0.5% or 1% of kids will get seriously ill or in the hospital. But the challenge with percentages is they aren't equipped to handle large numbers. And so with Delta variant, we're seeing so many more children become infected than I have ever seen at any point during this pandemic before. So those numbers are rising. That also then means that the risk is rising to be a part of that 0.5 to 1%. Now, I sometimes get the argument, well, why do we care about such a small number? And the best way I can explain it to people is when I look through my panel of patients, I can't think of a single one of my patients that I'm okay with them ending up in the hospital or ending up needing a ventilator or needing a heart and lung bypass machine. 1% is too high. It's just simply not acceptable. I'm shooting for 0% of my patients to have these things, and I would hope that our community would help me in shooting for that same goal.
Good. Thank you. All right. Do you want to add anything, Jeremy, or pitch anything in here before we go on?
No, that was great. Again, I think we are very fortunate to have some wonderful physicians here in Union County who have really been on the front lines and taking care of this community, COVID aside, and obviously during COVID. And again, I think the moral of the story, and I think if we were to weave the fabric together, is we're all concerned about hospital capacity, and it's not just because of COVID. And we need everybody to be healthy and to make good choices.
Good. So let's pull in our county and city folks to kind of give you guys a head up. And so add in Matt, Scarfo, and Steve, and Robert Strope. As soon as you turn your camera on, I'm going to have you jump in. And so, Matt, let's start with you. You are the person locally. I mean, I don't know, the county health kind of falls. You guys have divided areas of the county, and county health squarely falls on your shoulders. Why don't you talk about what it is that you're experiencing and what are you seeing? What kind of a crisis is this?
Well, it's the same crisis I think that everyone was just talking about. But first of all, Jeremy and the doctors on this call, this has been fantastic. I was for a second there, forgot that I was on the show. I was just watching and intent and getting some very good information from you guys. Thank you very much. And I'd really like you guys to pass that thanks along to your other doctors and nurses and other staff. Thank you for what you do. I don't think you get thanked enough up there. As a county, we're actually been working closely with Jeremy in Grand Run Hospital, try to relieve some of the staff's pressures. And one of those things we're trying to do right now is do a mass testing off-site. And we're working with Emergency Manager Vore and OHA really closely on this one. Stay tuned. We will let you know when these mass testings will start. Hopefully next week or maybe the week after. But just anything we can to alleviate some of the staff up there and maybe give them a little breather for a week or two. I think that's really important. And the communication with Jeremy here and Carrie has been absolutely fantastic.
All right. Thank you. Jeremy, is there any specific questions that you want to direct or that you want these folks to address for us tonight?
No, I just, as I mentioned at the beginning, I really appreciate their support. We've had several calls together over the last, 18 months. And again, genuinely, they've shown concern and care for our hospital and our staff. And, again, we're very fortunate to have a full service acute care hospital here. We've been growing and expanding. We want to continue to support this community. And, really our ask is that we need your help now.
Good. Let me pull George into this. George, thank you for jumping in with us today. And I think that you four represent kind of the nuts and the bolts of local government institution here. And thank you for jumping in and being a part of this. Anything you want to add, George? School's getting ready to start. Anything you want to add to this conversation? You're muted there, George.
Thanks, and sorry. I would just say that, for us, we are a partner to GRH. We're a partner to local public health. The state has had many expectations on our school district to be working hand in hand with commissioners, with local public health, with Grand Run Hospital, with the emergency services to make decisions on how we operate. And so, I would say about 2 weeks ago, I had a nice conversation with Jeremy and Dr. Zach about how things were going. I get updated by Carrie Brujati as well on the impact of COVID in our county. I wind up sharing feedback as well as how we're operating as a school district. And we just talk about what we need to do to increase risk mitigation or to make sure we have good risk mitigation taking place in our school district. So when we talk about local control and we talk about making decisions based on local data and how we want to operate, and then local impact, local context, and also how our organization is functioning, I do rely on Jeremy and Dr. Zach and Carrie to give me some guidance. So for quite some time, they've been sharing with me the impact of COVID Delta variant on our county, and I've been able to share as well how things are going for us. Even for our school district right now, in the last 2 weeks, we've had 8 staff members, or 8 staff and students, and I apologize, that have had COVID or have had COVID symptoms. And then we've had at least one classroom that we've had to close down for isolation quarantine. And then we had one sports team that we had to close down for isolation quarantine. So we're roughly within a 2-week time period, around 25 to 30 staff members or students that we've had to isolate and quarantine. That becomes very hard on our operations for us to lose staff members and then to lose students, and then for us to figure out how to keep operating. When for our school district last year, we had about 598 events total where we had to make decisions for isolation or quarantine due to COVID symptoms or having COVID. Or being a part of a close contact. We're already in just 2 weeks at 30 for our school district. So it is impacting us. What I've been told about our students that have it has been that we have students that have lost 20 to 30 pounds from sports teams and what they do with their sports team and folks figuring out. So return to play and anything that we have to do that has to do with health and safety, that's a strong consideration. So we know that it's impacting our students very, very severely. We've had staff members also that are severely ill, and I've been told that they've lost significant amount of weight. Last year we didn't have one student that was playing sports where they had an event where they had COVID that I know of, and that it resulted in a close contact isolation quarantine for our school district for that sports team. We've already had 3 different sports teams in this last week that have had students with COVID, and it's impacting their operations. So we're on a very heightened state as well. I would just say again that we're a partner to GRH and local public health. They help us with our decision making. We want kids in school every day. We want kids in school all year long. We want kids participating in club sports and activities. We want them healthy, learning, growing, all those kinds of things we want, but we want them safe. And we stand with GRH for anything that we can do for increasing our risk mitigation. One of the things we will do, even though it's a state requirement to wear masks, we are implementing that. And then we're going to be operating in high risk as we start out our school year. And we're going to have a town hall as well, and we'll explain what high risk means for us. But it definitely means wearing masks, when we're indoors. The other thing I would just say back to local public health or local decision or local control, it does work where we have to talk to GRH, local public health, talk to emergency services, county commissioners, talk to school district, talk to a board, talk to county commissioners, all of that. We have to do all of that. And once they give us recommendations, such as we got to operate in high, we would have been saying it's a requirement to wear a mask, whether the state made a mandate or they didn't. And that's really how local control works. So I want to make sure that folks understand that.
Thank you, George. So, Matt and Steve, one of the questions that we're having specifically directed to you guys, lucky you, is what are your thoughts about attending large concerts or community events at this time? And Steve, let's start with you. We haven't heard from you. Thanks for joining us today.
Thanks, Brent. And I want to thank Jeremy and the hospital staff for everything they're doing here. You're in a tight place, and they're delivering great service to our community. Should we be attending large gatherings? I don't. I'm not a physician. I'm not prepared to recommend one way or the other, but I'm vaccinated. I wear a mask when I go in Safeway because it's required. I don't know if I'm infected. I have not been tested, but from what I've heard this evening, even though I'm vaccinated, I could be. And if I'm carrying the virus, I don't want to go to a place where I think I'm going to spread it. And so I wear the mask, and I want to avoid large gatherings. I think I'm not an epidemiologist, and I'm not going to speculate on the numbers that we're seeing now, but there could be some repercussions from recent local gatherings in the next few weeks. But I would not go to a concert.
You have any thoughts on that, Matt?
No, I believe the mayor did a pretty good job at that. I know that Roundup is on its way here, and makes me nervous. I enjoy the Roundup very much so. And I say, I'm sure the staff here, Grand Island Hospital, say be very vigilant. Do not do anything that would cause more spread. If you have symptoms, do not go. I know those tickets are expensive, but just please don't spread this anymore right now. I think I could probably get an amen on that one.
Brent, can I share something real quick?
Yep.
Just as a quick thought, we have since last year in January, we started operating much more with in hybrid. So we had at any given time about 1,200 students on site wearing masks last school year. And of those events where I said 598 times, we did not have one event of COVID taking place, cluster spread, or anything taking place with folks wearing masks within our school. Most of the events that took place happened off-site, but then students where staff contracted COVID. My point is in telling you that is by April, we started our fourth quarter and we had roughly 2,000 students a day in our schools with also about 300 employees on our school site. So doing those numbers, that's about 2,300 people operating in our schools every day for about 45 days in a row at the height of when we could operate. And folks were wearing masks. And my point in that is it was a significant risk mitigation strategy that kept our schools operational, allowed us to play sports, allowed us to operate every day with kids in our schools. So do I think it's an important risk mitigation strategy? Yes. And does it keep businesses operational or school districts operational? Yes. So if that's a large crowd, I'm trying to give you an example of how it's a large crowd.
Good. And I think that the point is, I mean, so your point, George, is it worked for you guys. It's worked for the school district. It's worked to mitigate the spreading of COVID last year, right? Is that what I'm hearing you say?
That's exactly what you're hearing me say. Okay.
And so, I mean, there's just we're all a part of the buzz. If you're on social media at all, there's just, everybody is tired of this. They're exhausted. But I think that, the bottom line is just do what you can. Do what you can. If you bought expensive tickets and you feel safe going, then you should be able to do that. But at the same time, be compliant. Do what you can. And so I think I want to bring Dr. Steve in on this conversation because this is kind of your bent. I don't know. Do you want to throw in something on that?
Sure, I'd love to. I couldn't agree more. I think everybody's literally exhausted. We've been ground down. Where people are more annoyable and brittle than I can ever remember having seen other people in my entire life. People are walking around ready to snap at the slightest provocation. And if I'm being totally honest, I feel exactly the same way. I find myself getting so angry if someone goes in front of me at a four-way stop. Come on, it's LeGrand. My commute to work is literally less than 2 minutes. I can't wait for one little old lady to slowly putter off in front of me. Come on, guys. Now is when it's the hardest. It's the most taxing. We don't want to do it the most, but now is when it is absolutely the most important to say, I care about people.
So you deal with masks. I mean, you deal with this all the time. Speak from your own personal experience, if you would, the effectiveness of masks for you. I don't know, because I think that we need. I'd love to hear from a doc talk about this. There's a ton of opinions out there, and I don't really want to get into it. But what is your own personal experience?
Well, I would say if we were talking about a poisonous gas, and a gas mask could protect you from enough of it so that it didn't kill you, even though it wasn't 100% effective, you'd probably say, gee, I think I'm going to wear a mask. I'm not claiming, and I don't know any credible people who are claiming that these little paper masks that we put over our faces catch 100% of the virus particles that we're exhaling if we are infected. That being said, we do know, and this is a long-standing known scientific fact, the majority of the breath that you breathe out is water vapor. And the majority of the viruses that you breathe out are attached to water vapor. And what catches water vapor really well? Little paper masks. If you want to look at outcomes, we wear them in the hospital. And our incidences of cross-contamination have been spectacularly low. I can also tell you that last winter was the best influenza season I ever dealt with in my entire life. And that's not a coincidence. I've been doing this for more than 20 years. Every year we get a huge run of influenza cases. We didn't get it last year. I mean, you can talk to Dr. McAmoyle. He probably runs more tests than I do. But I think I took care of 2 or 3 folks in the hospital with influenza. The masks are effective enough to significantly reduce the risk of transmission. They are not completely effective. They are not a miracle cure, and anyone with a predetermined agenda will be able to find an exception where they can point to the fact that the masks aren't perfect. I don't care about exceptions. I care about the rule. I care about 90%.
Good. Thank you, Dr. Steve. So, Jeremy, let's pivot back a little bit to hospital business. One of the questions is Grand Ronde Hospital planning on canceling or postponing elective surgeries?
Right now, the answer is no. We have a team that meets every day to look at our PPE, look at our census, look at our staff, available beds, and so forth. And so far, we have been able to continue to offering elective surgeries. But I can't say that we won't get to a point where we will have to cancel. It really is on a day-by-day basis right now, and working close concert with our nursing staff, with our surgeons, and so forth. And again, we hope to be able to be one of the rare hospitals in Oregon that continues to provide that needed service for our community, because the community is supporting us by preventing the spread.
Okay. And then what is the actual capacity of, talk specifically about the capacity issues that we're experiencing locally?
It's very complex. We have 25 beds. We could certainly ramp up if we had to, if there was a mass influx, if there was a big car crash on the interstate. We've got some alternative care sites set up here in Union County. But the real limiting factor for us right now is staff. We've got a 6-bed ICU, and the reality is if we've got 3 or 4 COVID patients in the ICU, that's about all we can take, because the labor, the one-on-one nursing that takes is very intense. The PPE, the equipment that they have to wear, is very intense, and it's hot. And so again, the reality is that we're struggling because of a staffing issue. There are beds available. The other issue is that we are seeing nursing homes and long-term care facilities who are also struggling with staff. So we have patients that could get discharged from the hospital, but the nursing home can't accept them. And so again, as I mentioned early on, we really are seeing a healthcare system that is being strained by a multitude of factors. And this is where it is so important for us to do what we can that's within our control. And that's the vaccine, that's masking, and being smart. If you've got symptoms, avoid those gatherings.
Okay, so for everyone, we're getting close to the end of our time. We're kind of going to do a lightning round here. So, and Jeremy, you're not necessarily good at short answers, but I'm going to give you so a couple more questions for you. Do we still have access to 160 cots that we brought in by the National Guard? Is that still a thing out there?
We still have available. Yes, we still have access to cots here in the event that there's a mass influx. Yes.
Okay. And what is the plan for testing unvaccinated healthcare workers at Grand Ronde Hospital? Are there enough supplies?
We are still working on developing those plans. We are concerned that there's going to be a national shortage of some of the testing supplies.
Okay. All righty, Carrie, I'm going to pull you in. Let's see, where's that? What is CHD's role in this, and do they take any action when the health of community reaches unprecedented circumstances like this?
Yeah, I can answer that. I mean, the role of a public health department in this type of response is to obviously do case investigation and contact tracing, provide information to the community, and we play a pretty significant role in vaccinations. Public health isn't making policy decisions, so we're really advising the policymakers, providing information, and doing the best that we can to keep those kind of areas of our response that are up. We are doing a little bit of testing as well. So that's really what public health is doing right now. And I think, investigation and tracing really is designed to slow the spread. We focus on people that have the virus and isolating them, people that might develop the virus because they're a contact, and also having them quarantined. Right now in our surge, we have so many cases that we can't make all those phone calls. So I would also just ask that our community help us and really, like, I think most people know by now what the recommendations are. If you're sick, it's 10 days. If you're a contact to a confirmed case, it's 14 days. Just stay, just do your part to stay away from other folks to try and slow the spread. That will really help.
Good. So if you're a provider or you want to throw in on a conversation that we're having, please use the private chat function. If I don't see you, wave at me. Dr. Frank, here's a question. Is the COVID vaccine safe for someone with severe asthma or allergies? I don't know. That's basically it.
Yeah. Well, that question comes up a lot, and in many things in medicine, that conversation should happen in person, and you need to know the specifics and run through the risks and benefits for that individual. And that would be the message that I would put out. Come in, talk to a doctor, talk to one of the nurse practitioners, see what's right for you. If you have questions, we'll do our best to answer it, and be patient and don't put off your primary care. Get care.
Good. So Jeremy, another question is could you address the recent workplace outbreak at Grand Ronde Hospital? These are community acquired cases, correct?
Yeah, again, as I mentioned, we're not immune to the spread. We have, we are the largest private employer in Union County, over 700 employees. We have people who are very active in the community. And so, yeah, most of our employees contracted it outside of work and just happen to have the common denominator of being employed by Grand Ronde Hospital. It's the same at other employers here in town. And, and I look at some of the surge of patients that we're seeing in Southern Oregon and Bend and so forth. Their workforce is also being decimated because, again, they're contracting this out in the community. It's very transmissible, this Delta variant. And so, yeah.
All right, George, we have a question for you. Is the district providing clear guidelines for families to follow that under no circumstance should children with symptoms like runny noses and scratchy throats come to school? Which, yeah, I don't know.
Yeah, that's a great question. I think tomorrow we're doing our town hall. After that, we're sending out our notifications to parents, welcoming back everyone, but also we're including all of our guidelines that we have for risk mitigation and guidelines that we have for COVID symptoms. We have a COVID symptom cheat sheet that we use, and we'll explain a lot of our operations and safety practices. We'll do that tomorrow in our town hall. I believe it starts at 6 o'clock. It's on the Grand School District website and our Facebook. And then also we'll be sending letters out to families that indicate that we're operating.
All right. Okay. Let's see, I've kind of lost track. Why don't you talk for a minute, Jeremy? Yeah. Let me go over these questions for a minute. Yeah.
Sure. Again, I would point folks in our audience to recent data from Oregon Health Sciences University that is really seeing a dramatic increase in the spread of COVID-19. We're seeing an increase in hospitalizations. I believe I read just before this town hall that there's only 10% of the ICU beds available in the whole state of Oregon. So again, this is not just a local issue. It is a regional and national issue. But we are, again, doing okay. We are managing through this. And we want to continue to keep open and providing the care that you expect from us in a timely manner. But we're going to need your help.
Good. Well, thank you all. Let me just pull everybody on again, and for as many as possible here. And like any last words that you might have that you want to throw in on. Carrie, let's start with you. Is there anything you want to add?
No, I just really want to thank the hospital for providing this opportunity for us to share the information. And yeah, I mean, I really appreciate the opportunity for us to talk about this and hope that we can come together and take some action to minimize what's we're seeing with the COVID virus right now. Thank you.
All right. Thank you. George, anything you want to jump in on here?
Just in case, because Jeremy had asked us to participate, that we are their public, we're their partner, we're the partner to local public health, we're the partner to GRH. Our operations does impact them, and what we do with students and what we do with staff and how they go back to their household impacts their operations. And so their operations also impact us when they can't do any, when they don't have enough staff or when they're at their capacity. It does make us have to look at what our practices are and how we can adjust our safety or our risk mitigation practices to ensure that they're operational. So it's important that when local public health or Grand Run Hospital tells us what they think they need us to do, that I listen to them. We work well with each other, and it's important that we support them.
Good. So Dr. Mack, I think you have something you want to share with us too. I got the note and missed it. So talk to us for a minute.
Yeah, I got a couple things. I've been jotting down some notes since other people were talking. I want to let people know that if you come to the ER, we're really trying to bring our COVID patients in a side door. We screen them at the front door of the hospital, and then we figure out how we can limit contact with them, with anybody else that's coming into the ER. I don't want people scared thinking I can't go to the ER and be treated for my abdominal pain or chest pain or something just because I may come in contact with COVID. We are really trying our best to limit COVID symptoms being inside the hospital. We'll bring them around the side door. We'll take them straight into a room. Doors are closed in the ER so that we isolate everybody and try to limit contact. So I want people to know that they can be safe coming into the ER. And then just like Dr. Shumsky said, don't not go to your primary care provider. If you're having symptoms and you think you have a severe problem, such as appendicitis, heart attack, stroke, anything like that, I want you to come to the ER and get checked out. Don't try to stay at home with it and live with the consequence. Or with a heart attack, you may not live with it, you may die. The monoclonal antibodies, we have done a few of them in the ER. There are some criteria you have to meet. So if you come to the ER and you don't meet the criteria, like if you get placed on oxygen, that rules you out for the monoclonal antibody. So we won't do that in the ER. There might be times you're diagnosed with COVID and we just ask you to follow up with your primary care provider and make a call, or we send a referral so that they can get you screened properly, whether you fit the category for the monoclonal antibody or not. The duration of the stay in the ER for the monoclonal antibody can be several hours, just so everybody knows. I would really reiterate that anybody that's immunosuppressed, I highly, highly, highly recommend you talk to your doctor about getting the vaccine. Obesity, heart disease, COPD, all these things can lead to a worse outcome with COVID-19. And we've seen it a lot recently with this Delta variant. And the last thing I would say is, well, if you have COVID, if you do have COVID and you're staying hydrated and you can breathe all right, you're not really short of breath, the best thing to do for those patients is to stay at home for supportive care. It's when you start having, if you're getting severely dehydrated from diarrhea, which several people are having, or if you're getting to the point where you think you can't breathe right, then you need to come to the ER. And then please have patience with us because we're busy. Everything's really busy right now.
All right. Thanks, Dr. Mack. So, Dr. Frank, you have something you want to throw in here?
I think Dr. McEmoyle did a very good summary on what needs to be addressed. I would reiterate also here at RMC, we screen our employees every day, every morning, every shift. We have isolation rooms to be used for patients that we suspect are COVID positive. And we have a process in place to keep the rest of the patients isolated and safe from anybody that might be COVID positive or is COVID positive.
All right. Thank you. Dr. Zach.
Thank you. I really appreciate the opportunity to be here. And I think it's meetings like this that give me a lot of hope. I want everybody to virtually, so to speak, look around the room. We've got so much represented here of what LeGrand is, what Union County is, and what Grand Ronde Hospital is. We have experts from the hospital. We have physicians across multiple disciplines. And I'll share a side note, getting a bunch of physicians to agree on something, that's actually very hard to do. But you've got at least 5 here on this call who are all in agreement, and many more who agree who are not on this call about the importance of mitigation measures. We have public health, we have commissioners, we have county level representatives, and we have city level representatives. I think this is all us coming together to say this thing is real, it's out there, stay safe, get protected, and be smart.
Good. Thank you. Dr. Whitaker.
So the only thing I would like to add is that I get the frustration, trust me. Like Dr. Hunsaker said, I could snap, feels like any second. I hate wearing a mask every day, all day long, I hate it. But when I look at things around us, sometimes it's about protecting the people you love, the people you're around. Even if you're not worried about yourself, the fact is you could give it to somebody who won't survive the COVID. And so do the things you can do to help protect those that you love around you, including vaccinations and masks and staying away if you're sick, and know that it is helping. And from a personal standpoint, my parents both had the vaccine. And they both were diagnosed with COVID just a few days ago. They're in Montana. And the fact is that my dad would not have survived. He has very big health issues. And I truly believe that if he hadn't had that vaccine and he had this variant, he would not be with me right now. So he is doing well. He really has no symptoms. And so it is worth looking at the big picture. It's not political, it's medical, it's protective, it's people that you love that you need to worry about.
Good. Thank you, Stacy. Appreciate it. Dr. Steve, talk to us.
Thank you. Thanks for having me again. I think everybody has made every point that needs to be made at this point. So I would like to go out on a positive note, doing something that I do a lot here in the intensive care unit, and that is being a cheerleader. You should never quit, because you should know that no matter what, we will never quit. And rah, rah, rah. Let's kick it in the rear.
All right. That's good. Thank you. And I just want to say, I mean, you know, Stacy is from Montana. Dr. Steve grew up in Baker City. Jeremy grew up in Baker City. I mean, these people have redneck stuff in their blood. I mean, I'm telling you. And so, and the point of that is that they genuinely are Eastern Oregon, and their bottom line care is doing what it is that they can do. So, thank you. And so Steve Clements, Mayor Steve, talk to us. Give us some final words.
Just to reiterate what Jeremy's asked for at the very beginning, talk to your primary care provider about vaccinations and what it means and what it can do and what it cannot do. Wear a mask and social distance. More than one person has said this. We're all in this together. It's really a shame that I think that COVID is really raging through the unvaccinated population right now. The people that are vaccinated, like Dr. Whitaker said, are exhibiting symptoms, but not seriously. And the few breakthroughs that I've heard about are people that have been really compromised overall anyway. We're in this together. If there was a forest fire that was blowing in our direction, this community would pull together in a heartbeat. I wish that was the case now. Thanks for having us here.
Yeah, thank you. Mr. Matt.
Yes, I would. This has been fantastic. I am very honored that we have the staff we have up there on the Hill taking care of us. This has been a very great town hall round table. I know I've said this before, I'm not really a big social media fan, but if you're watching this right now, share this. Let's get this out there. This is very good information. I've learned a lot myself. And thanks again, Jeremy and everybody at the Grand Island Hospital. And once again, pass it down to the other nurses and staff for us as well. Thank you very much.
You bet. All right, George, give us some last words.
I think I said my last words. We're going to have a town hall tomorrow for our own
that's right.
risk level, our strategies, our operations, our safety plans. And back to kind of we all have a great responsibility for the healthcare and the safety of others. And I think we have an obligation to create a better future for our community. So we do need to support our health and safety officials and organizations on behalf of our students, our staff, our families, and our community.
All right. Thank you, George. All right, Jeremy, anything else you want to throw in here?
Again, I just reiterate, the famous song, I get by with a little help from my friends. And, be patient with us. We still have visitor restrictions at the hospital. Wear a mask. Be patient with our staff. They are tired. They are exhausted. Many are pulling extra shifts, extra hours to take care of you, your neighbor, and your loved ones. And it's a privilege to take care of this community, and we ask for your help to support us.
Good. And the bottom line is that from your standpoint, we just don't want to overwhelm our local hospital to be able to take care of the everyday things that you guys do day in and day out, the personal health. And I mean, that the whole purpose of and the benefit of us having a local hospital is that those routine things can be taken care of right here at home.
Yep.
And to preserve that, it just means that people can help by not getting COVID, and they can help by not getting COVID by getting vaccinated. And doing what they can, wear masks and wash your hands. I swear I'm a hand washing person now all the time, and there's not a soul here. There's nobody that I talk to that's like, oh yeah, I love wearing a mask. It's a part of my fabric now, So, yeah, well, thank you, Jeremy, for putting this together. Thank you for all of the people behind the scenes that are making all of this happen. Anything else before we take off?
No, just thank you, and hope everybody has a wonderful evening.
Good. And thank you, Eastern Oregon, for jumping in with us today. And I just want to tell you that, again, I want to remind you to be civil to each other. Even the vaccine conversation, I've been involved in this. I mean, Carrie and I started talking over a year ago, every other week about the CHD COVID updates. I have a lot of information, and choosing whether to be vaccinated or not has been a personal struggle for me, partially because, there were times I was more afraid of the vaccine than I was the disease, but that's changed. And the bottom line is Delta is hard on fat people. And so because of that, I kind of dove into that too. And so I just want to encourage you that do what you can. What you can do is you can wear a mask without belly aching and complaining. And, yes, I know that it affects your life, but, and nobody here, Dr. Steve, it's like, yeah, it doesn't fix everything, but again, it's what you can do. The vaccine doesn't fix everything. There's still going to be breakthrough cases. But like Stacy Whitaker said, Dr. Whitaker, that, she's totally convinced it saved the life of her father, whose health is fragile. So, and I know that those kinds of things are happening everywhere. So do what you can. Thanks for jumping in with us tonight. Thanks for being a part of this.